ever wondered why you feel unwell so often, despite leading what seems like a healthy lifestyle? You're not alone. Today, we're diving deep into a hidden culprit that's affecting millions worldwide: chronic inflammation. It's more than just a buzzword, it's a serious health concern that could be silently affecting your life. To understand chronic inflammation, let's compare it with its short-lived counterpart, acute inflammation. Acute inflammation is normal and okay for your body. It is your body's immediate response to an injury or infection marked by redness, heat, swelling and pain. It's quick and crucial for healing. To elaborate further, let's consider how acute inflammation works in response to common illnesses like a cold or the flu. When you catch a cold, the virus invades cells in your respiratory system, prompting your immune system to act as a matter of emergency. This response includes sending white blood cells and other chemicals to the infected area. That is, the process increases blood flow to the area, causing the redness and warmth you often feel. All this causes blood vessels in your mucous membranes to expand, making your nose run and your throat swell, thereby helping white blood cells reach the infected areas faster. This is crucial because these white blood cells help fight off the invading virus. The symptoms of a cold, such as a runny nose and sore throat, are actually signs of this process in action. Similarly with the flu, the fever you experience is another aspect of acute inflammation. A fever develops as your body's temperature rises to kill off the virus and create an environment less suitable for the virus to thrive. The heat, one of the cardinal signs of inflammation, not only helps kill the virus, but also speeds up the activity of immune cells, which are more effective at higher temperatures. In these cases, acute inflammation is beneficial and indicates that your body is actively fighting off an invader. It's typically resolved once the threat, like the virus causing the cold or flu, is eliminated, leading to recovery. This is why acute inflammation is considered a necessary and protective response. On the other hand, chronic inflammation is a prolonged, often silent, inflammatory response that can subtly wreak havoc in your body. Unlike acute inflammation, chronic inflammation doesn't turn off as it should after dealing with an immediate threat like an injury or infection. Instead, it continues indefinitely with no clear symptoms. For example, if someone consistently eats foods that are high in sugar and unhealthy fats, or if they're constantly exposed to environmental toxins like cigarette smoke or pollution, these can perpetually trigger the body's inflammatory response. This low-grade inflammation can persist unnoticed for years, altering cellular processes and potentially leading to tissue destruction. I repeat, this can go unnoticed for years, harming your health while you think you are okay. The damage from chronic inflammation is cumulative, meaning the longer it goes unaddressed, the more significant the harm to the body's tissues and organs, which can lead to various chronic illnesses. For this reason, managing factors contributing to chronic inflammation is crucial for long-term health. Let's delve into what fuels this persistent inflammation. Key lifestyle factors include 1. Diets rich in processed foods and sugars, which for example may be fast foods with items like burgers, fries and fried chicken. 2. Sedentary habits, which is a lifestyle characterized by a lot of sitting or lying down, with very little to no exercise. 3. Unmanaged stress leading to a continued state of tension and anxiety. 4. Pollution exposure. Continuous exposure to environmental pollutants results in ongoing inflammation, as the body remains in a constant state of alert trying to neutralize and remove these irritants. 5. Inadequate sleep. When sleep is insufficient, the body produces higher levels of inflammatory markers. 6. Excessive alcohol consumption. Regular and excessive drinking can lead to inflammation of the liver and other organs, disrupting normal bodily functions and increasing the risk of chronic diseases. 7. Smoking and exposure to secondhand smoke. Smoking cigarettes or being around smoke can lead to chronic inflammation in the lungs and throughout the body. 8. Obesity. Carrying excess body weight, especially around the midsection, can drive inflammatory processes, as fat cells release inflammatory mediators. 9. Use of certain medications. Long-term use of some medications, including certain pain relievers and blood pressure drugs, can lead to or exacerbate inflammation. The list is inexhaustible. The effects of chronic inflammation are profound, influencing nearly every aspect of your health. It's linked to serious conditions like heart disease, diabetes, arthritis, bowel diseases, and even some cancers. Type 2 diabetes. Chronic inflammation is closely linked to the development of type 2 diabetes by interfering with insulin function, a key hormone for regulating blood sugar. Persistent inflammation leads to insulin resistance, making body tissues less responsive to insulin. This forces the body to produce more insulin, straining the pancreas and eventually reducing its ability to produce insulin effectively. Over time, this disruption in insulin production and function can lead to type 2 diabetes as the body struggles to manage blood sugar levels properly. Arthritis. Chronic inflammation plays a significant role in the development of arthritis, particularly types like rheumatoid arthritis. In such conditions, the body's immune system, which normally protects us by fighting off invaders, mistakenly attacks the joints. This prolonged inflammatory response leads to swelling, pain, and stiffness in the joints. Cancer. Chronic inflammation has also been associated with increased risks of cancer. When inflammation becomes chronic, it creates an environment in the body that is conducive to cancer growth. The persistent inflammation damages cells and can lead to changes in their DNA, which is one of the first steps towards cancer development. Additionally, the ongoing inflammatory response promotes an environment that supports tumor growth and spread. Substances released during chronic inflammation can also encourage the growth of blood vessels that feed tumors, helping them to grow and invade other areas of the body. Aging process. Chronic inflammation can accelerate aging, not just by wearing down tissues and organs, but also by affecting skin health, leading to premature wrinkles and a loss of skin elasticity. It increases vulnerability to age-related diseases due to accelerated aging process. Neurodegenerative diseases. In terms of brain health, chronic inflammation is increasingly being recognized as a factor in the development of neurodegenerative diseases, including Alzheimer's disease and Parkinson's disease. This is because prolonged inflammation can lead to the accumulation of damaging proteins in the brain, affecting brain function and leading to cognitive decline. It can also significantly affect mental health, contributing to conditions such as depression and anxiety. Imagine a slow-burning fire inside your body, subtly damaging your systems without obvious symptoms until significant damage is done. Recognizing chronic inflammation can be challenging due to its subtle nature. Common symptoms often manifest as fatigue with a lack of zest for life, persistent joint or muscle pain, unexplained rashes, unexplained back pain, abdominal pain, or even ongoing digestive issues. These symptoms might seem benign individually, but when persistent, they could be signaling underlying inflammation. Fortunately, chronic inflammation can be managed and even reversed with proactive lifestyle changes and medical interventions. Adopting an anti-inflammatory diet rich in fruits, vegetables, whole grains and omega-3 fatty acids, integrating regular physical activity, improving sleep quality and managing stress are pivotal. For some individuals, medical treatments such as anti-inflammatory medications may be necessary. Additionally, exploring holistic approaches like the Melelo body rebalancing can provide more personalized strategies. curious about how to further combat chronic inflammation? Subscribe to our channel, leave your questions or experiences in the comments below, and share this video to help spread awareness. Your engagement helps us create content that addresses your health concerns. Thank you for investing your time with us to learn about this critical health issue. Remember, managing inflammation is a step toward better health. Now, watch the video with the Melelo body rebalancing approach for effective practical steps in addressing chronic inflammation.